Hi everyone, Liz from Tutor2 here. I'm joined this evening by Laura and Charlotte. Laura below me and Charlotte above me. Hi guys.
Hi.
Hi. And tonight we're doing our NCFE T-Level Health exam clinic for Paper A and Paper B. So we will run through our top tips for those two exams and also take any questions you have. So please make sure you're a subscriber to the channel and then type your questions in the chat. I will pick some really good questions and Laura and Charlotte will help me to answer them. So do type your questions in the chat, guys, and I will bring them in as necessary. So I'm going to hand over to Laura to start us off to talk about how we should revise, bearing in mind we've got 1 week left till paper A, 2 weeks till paper B. So Laura, what should we be doing?
Okay, thank you for joining us, guys. Thinking about revision then. So we've got a week till paper A, like Liz said, and a further week till paper B. So you want to be thinking about, actively revising. So what we mean by that is not just copying out notes. I know you make your notes look pretty. I know it's really tempting to highlight them, make them look beautiful, but that's not effective revision. We want to be able to recall information. Okay, so that's what we mean by active revision. We want to be focusing on timed exam questions. So hopefully you've done some mock exams with your tutors in college. You will know from doing them that the timing, even though you've got 2.5 hours, it is quite tight. Okay, so we want to be practicing how long we should be spending on each question. And we're going to come back with a few more tips on that in a few more slides. I would advise creating some concept maps. Okay, so what we want to focus on is small topic areas. So ones that are easy to digest, easy to sink in, but ones that you feel least confident in. Okay, I spoke about this on an earlier live stream for a different course, but every student does it. We like to spend time on the topics that we feel confident in, and we like to ignore the ones that we don't want to see. So we want to be spending time on those ones. You'll know that legislation is very heavy in the T-level health, so we want to be doing a brain dump on the legislation or service user groups. Okay, so thinking about those different types of service user groups, how they might be impacted by the legislation as well. Thinking about 1 week before, so you do want to try and sit a whole paper, so give yourself a real feel for what it's like to sit in those conditions, those timings based on what me and Charlotte are going to tell you shortly. And thinking about the night before, we don't want to be cramming, okay? Please don't do that. Keep it low stakes. We want to focus on basic recall, and we can support you with that as well. And we'll give you some further information on that on a later slide.
Thank you so much, Laura. So some more tips about revision then, about the content we might expect to be tested on.
Okay, so hopefully you've learned a lot of content by now, guys. Okay, your tutors have been busy educating you, you've been busy doing the work. And sadly, any of that content can be tested, but let's see that as a positive, okay? All that knowledge that you've absorbed, you could potentially have an opportunity to demonstrate in this exam, okay? So anything is open to being examined. Try and make links between topics and service user groups. So we know on these papers that they love to see that, okay? Can you link those topics? So what we mean by that is, for example, safeguarding and mental ill health. Can you see the link between those two topics? Okay. How might they interlink? What sort of explanations might we see? Same for safety and later adulthood. Okay, so people in that age category, that service user group, how might they be impacted by safety? How might we manage their safety? What legislations might link to keeping them safe as well? And similar, we've just got another example underneath. So thinking about infection control and community settings, what type of policies might link in there, what type of practices, your SOPs, okay? Thinking about the settings that come under community settings. Those are just some examples of how we might see interlinking exam questions being asked, especially on the bigger mark ones.
Brilliant. Yeah, I think at this point in our revision, it's a really good opportunity to start bringing knowledge together, isn't it? Instead of thinking about it as separate elements, how does it all hang together? Because as you say, a lot of those questions, they might have a scenario with a few different topics interwoven. And especially for those longer mark, more difficult questions, you are going to have to draw on your knowledge from various topic areas, not just one simple little area. Okay, so let's think then about time management because, as you said, 2.5 hour long paper. Charlotte, tell us about paper A and time management.
Yeah, so we know that our paper A, as Laura said, there's a lot of content within there. There's a lot that can be covered. And paper A is 2 hours and 30 minutes long with your total of 116 marks. The exam is split into 4 sections, which examine different parts of the content. So we've got a bit of a rough guide that could support you with your time management with paper A. So, for example, your 1 mark, your low stakes questions, generally command words such as identify or state. You're looking at about 1 minute. And if you can bank up that time, if you can do it quicker, if you are 100% confident, you could bank some extra time there as well. So, moving on, you've got your 2 mark questions. This might be an outline or a describe. You're looking at about 2.5 minutes for one of those. Moving on to your 4 mark questions, this is where sometimes they can be a little bit more challenging. It might be that you get an exam question that consider the command verb of that question. So if it's an evaluate, you need to be right into that standard. It might be that you've been asked to describe or explain to. So although we've got a rough guide, always think about that exam command word and the marks available. And especially if it's asking for one or if it's asking for two, that helps you determine how many points you're making within that answer. So for your 4 mark question, around 5 minutes. 6 mark question, we know that these are our banded answers. So we're looking at putting some more time into those, thinking about the command word again. It might be a discuss, it might be a to what extent. So we're thinking about those magic words such as however, on the other hand, the impact of this. And then our 12 mark questions, we know that we get 9 marks for the answer itself and then 3 marks for the quality of written communication within there. These are the ones where we can pick up those higher marks. So we're suggesting that you're spending about 15.5 minutes on those. Making sure again we've got those reasoned judgments, we've got conclusions, we've got benefits and limitations and all of that combined within that time. It's a really good idea to give yourself a little bit of a plan at the top of your page to make sure you know what points you're going to be hitting within that.
Brilliant. Okay. So you mentioned, Charlotte, that there's 4 sections. Can you just go over those for us so we're all on the same page?
Yeah, definitely can. So with paper A, you probably have already been told this by your teachers, or you've probably seen it yourselves on different resources that was set into 4 different sections. Each section assesses different parts of the specification, so different parts of the content you're being taught. For example, section A covers A1, A2, and A7, and that's worth 33 marks. So thinking about how many marks overall that's worth, you're looking at about 42 minutes for that first section. Section B is all about managing personal information and data. So all of that information that links to GDPR, confidentiality. 25 marks for paper B. So sorry, section B. So you're looking at 32 marks for that section. Section C is health and safety. Everybody's favourite topic, health and safety. Again, that is worth 25 marks overall. So we're looking at 32 minutes for that section. And section D again is worth those higher marks of 33 marks. So we would recommend about 42 marks in total for that section as well.
Brilliant. Thank you, Charlotte. One of the things that I just wanted to bring up is so these sections of the exam paper are testing those elements. However, I think I'm right in saying that you can weave in your knowledge throughout the paper. So, if you had a question about managing personal information and data, safeguarding is relevant in
Oh,
within that,
absolutely.
isn't it?
I was actually just saying this the other day to a group of my students that um, the questions are holistic in a sense, so you can bring in. So if you're talking about working in the healthcare sector and the question is related to A7, which is standard operation procedures, then realistically you probably might bring in something like COSH or the Health and Safety at Work Act. You'll bring in infection control. There's a lot of things that can combine within that answer.
Okie doke. Okay, I see a couple of questions. We'll come to those in a moment, guys. Let's just think about the time management for paper B. So, Laura, over to you for this one. It's quite similar, isn't it?
It is, yeah, absolutely. So as Charlotte explained for paper A, similarly for paper B, we want to be thinking about how much time we're going to spend on each mark. I'm not going to talk through each of those because I know Charlotte explained them beautifully, but you can see on the screen, we're thinking about the bigger the question, the longer we're spending on it. Now, I know that sounds self-explanatory, guys, but it does represent the amount of detail and depth that the examiner is looking for in these questions. So please do bear that in mind when you're answering them.
Okay, and then the structure.
Yep, so paper B has 3 sections. So we've got section A, B, and C. So you can see the first 2 sections, slightly bigger markings, and so we recommend spending a little bit longer on them. If you think about dividing your time up into 3, though, guys, you're not going to go far amiss. So when you sit down for your exam, think about breaking that time up. Make your way through. Once you get yourself through section A, you should be a third of your way through the time, potentially a little bit further on. And make sure you give yourself enough time to go through it at the end and read through those questions.
Fabulous. And then so the details of the structure there on the screen, Laura.
Okay, so what you can expect from section A is cardiovascular, respiratory, nervous, musculoskeletal systems and some core concepts and potentially cancer. In section B, digestive, renal, help me out with that one, Liz.
Integumentary.
I can never say that one. Reproductive, endocrine systems, and again, core concepts, potentially cancer. But then section C, we're looking at your synoptics, so it can be anything in combination there.
Brilliant. Okay. So let's have a think then. Actually, let's have a look at these questions. Let me bring in a question here. Here we go. So edits, and then so he'll have the same question essentially. So for an overall B grade, what do you need to score on both papers? Do either of you have that information at your fingertips? I know it's quite complex.
What I would say is B grade is a very high grade, guys. It's fantastic that we're aiming for that. I don't have an idea of the grade boundary, Charlotte, to hand, do you?
So you give me 30 seconds
Okay.
and I can have a quick look.
Brilliant.
I think so. It is important to remember, just while I'm getting this up, that your exams are merged together to create one overall grade. So overall, for both papers, we're looking at 2 all. That's 132 marks out of 234 for a B. So that would mean your paper A, you're looking at about 70 marks, paper B 61. Obviously there's variations there. It might be a 60-40 split or a 20-80 split or something like that. But remember that they get combined, so you're looking at that overall mark.
Okay, I'm just going to type that in the chat. So I have put paper A 70 marks,
Sorry,
paper B
I'm back. I was on a different
marks,
screen.
would give you a B. Okay, brilliant. Thank you. Right, let's move that comment. Okay, so let's think then about the question types. So Charlotte, do you want to talk us through these kind of low stakes questions?
Yeah, so I touched on this a little bit when we've been talking about how long to spend on each question. So if we're thinking about our low answer questions, it might be identify one aspect of personalised care. It might be something very, very what we would think of as a straightforward question. Make sure, however, you are reading the question properly, because sometimes we could have a question that says state the role of the stomach, for example. Another question might say state the function or the purpose or something different, and that then tailors what the question is asking. So it needs to be tailored to your response of that. So ensuring that you've got that specific word, it's not just the command word, it's what it's actually asking from you. So making sure that you've read it properly and you understand those words, which is why practice questions and looking at mark schemes is really important. So requiring accuracy, are you on topic? So when we're looking at our 3 different assessment objectives, we've got our AO1, AO2 and AO3. Our AO1 is where we bring in that knowledge that we know. So do you know what you are answering, and is that correct to what the question is asking? Is it valid? Is it relevant? So moving on to relevance there again. So thinking about any information you've been given at the top. So the STEM, you might have been given a little case study, a little scenario. If you've been given one of those, use it, because it's much easier to explain something, identify something, state if you are referring up to an example. So using that within your explanation is really going to help you, and it shows that you can apply that understanding as well. So just going back to what I was saying about understanding what the question is asking of you, this is where our key technical vocabulary comes in. So it might be that you're being asked the role or a function or a purpose, and making sure that you know the difference of these different, what the question is asking you.
Okay, brilliant. So I think I'm right in saying that almost every question on paper A will have some kind of contextual statement with it, or
Yeah.
maybe a paragraph even.
For your section A and D, definitely. B and C, not so much, because we might be asked straightforward questions such as state the purpose of the Health and Safety at Work Act of 1974.
Yeah. Okay. And then on paper B, I know there are fewer contexts and case studies. They tend to be for the longer answer questions. But then the difference, I suppose, in the paper B is that you may have graphs and data to look at. And we've got something about that in a moment. So let's have a look now at describe questions. I'll hand over to Laura for this one.
Okay, guys. So for any question that begins with the word or contains the word describe, we want to be giving as many descriptive points as there are marks available. So the biggest clue for that is, for example, if you've got a 4-mark question, it's going to require 4 descriptive points. Now, examples are really useful to help you describe. It's quite hard to describe something without using an example. Okay. Again, them key technological terms and vocabulary. So if there is a more professional way or key technical term of saying something, then make sure you are demonstrating it to that examiner. We want to show them just how smart you are. Make your answer sound clever, okay, for want of a better word. And then think about, is your answer relevant to any context, and is it fully focused on the question? Especially when we're thinking about linking them to examples, guys, I would try and plan that out first before you start writing your answer, because what we see students do sometimes is go off on a bit of a tangent. You're under the pressure of an exam. Sometimes it can get easily lost in translation. So look back at the question. Is the answer that you're planning actually answering it? I know that sounds silly, but believe me, I've seen it done many a times.
Yeah, absolutely. So Sahil has a question. I'm going to say Charlotte maybe for this one. So in describe questions, are we being assessed on AO1, 2 and 3, or is it just AO1 or AO1 and AO2?
So for a describe question, you would it wouldn't be AO3 generally, because that would be your evaluate, your justify, and those type of questions. So it would be your AO1 and AO2. So it's your knowledge and your application. So it's generally a describe question might be that you are asked to identify an aspect of safeguarding, but then you'd get that extra mark because you get given a little bit of a case study. I'm thinking of one particular exam question. You might have done it recently. It's about Noah and Emily. If you've covered this one, what students get marks for here is where we talk about what the safeguarding role is of the staff members, and then that needs to be particularly applied to the residents that they're talking about. So doing that twice would get the full 4 marks. So we've had our knowledge and we've had that expansion of that. So we at Tutor to You like to use our what, so what, and now what, and I know it's one of Liz's favourite things to use. So in that case, if you look at any resources that we've got from Tutor to You, you'll see that our AO1 tends to be covered by the what. So what are you telling me? And then the AO2 is covered by the so what. So what is the point of what you're telling me? How does that apply to this case? And then our AO3 is now what. So what happens from there? What's our justification? What's our next steps? What is the impact overall? So hopefully that answers your question.
Yep. So just to recap, so for a describe question, we're looking at AO1, which is knowledge, AO2, which is application, wouldn't be AO3. So it's your what, so what. let's just have a look at this question from Gemma, which is it's kind of like a big question, really. Could you provide some examples of key technical terms we can use that do appear more professional?
Yep. So what I meant by that, guys, is, for example, you could be talking about how we manage personal information, and it would be absolutely fine to say we keep it private. Okay, it's not incorrect, but the more technical term for that would be to link it to the topic of confidentiality and linking, for example, the legislation that supports it or the policies. So rather than just saying keeping it private, keeping it safe, we want to be thinking about those technical terms that we can demonstrate to the examiner.
Absolutely. Charlotte?
Another example is particularly for paper B, a lot of students, we know exactly what high blood pressure is or low blood pressure is. It's then using that terminology that you've been taught. So high blood pressure is our hypertension. So using that instead of saying high blood pressure, because it shows that you understand that technical language, and including as much information in terms of the words like empowerment, holistic, independence. So aspects that link to your ethical care as well. So you could be talking about somebody's autonomy. You could be talking about acting in somebody's best interests with beneficence. So all of these words are gonna, if you're using them correctly, I would always advise that you use them correctly. Don't just be throwing words in there. If used correctly, you're still showing the examiner that you understand to a higher level, that you know what you're talking about.
Yeah. So these key terms, a lot of them are going to be the ones that are on the specification, aren't they? So, making sure that you've looked through the specification and you know all those key terms on there is really important. The other thing that I think is really great about key terms is it can help us to be more concise, because often one key term can be written out as one whole sentence if you're kind of waffling around. Just get straight to the point, use the key technical term for that, and you'll be sorted. Okay, we've got some questions about 6 and 12 markers, but I think we'll hold off on that until we get there with our slides. So thank you, Gemma, for that one. Okay, next we have explain questions. So explain questions, I don't know about you guys, these are the ones that are probably most frequently used on exam papers, and the ones that students often struggle with the most, because students tend to describe something or state something but not fully explain how or what or why. So Charlotte, what can you tell us about explain questions?
So like we've said previously, we're thinking about the command word and we're thinking about the marks available for that question. So usually with an explain question, you will get another prompt that says explain 1 or explain 2, and then that will then coincide with how many marks you've got available. So when you're explaining something, it's really important that we think about giving an example or giving a reason. So you're stating your initial point and then going ahead and giving that example. Might be related to the case study or the piece of information in the scenario that you've got, but making sure that you're relating up to that or you're giving an example. You might be asked about something similar to explain the purpose of policies within a healthcare setting. So you might explain the purpose, and then you could go on to say, an example of this could be a safeguarding policy. So you're just going on with that little bit extra, you're giving some more, and why you have stated that first part to begin with, putting it into context a little bit more. Because like we've just been saying about our AO1, AO2 and AO3, you're looking at your AO2 marks here. So our application of understanding. So can you apply that topic, that subject, that concept to either a scenario or the wider setting? So you could link it to the setting where possible.
Brilliant.
I think I've covered that actually.
Yeah, I think so. Okay, fabulous. So explain questions, yeah, definitely work really hard on those. There's lots of marks to be gained from explain questions. Because they sit in the middle, they're kind of AO2, you tend to have a bulge in all exam papers in AO2 marks. So you've got, maybe 20 for AO1, then you might have twice as many for AO2, and then 20 again for AO3. That's just a rough idea. So there is a lot to be gained there. Okay, so calculate questions. I'll talk about this one. So calculate questions you're going to get on your paper B. You're not going to have these on your paper A. Really important to remember, you can take a calculator into your paper B exam, and I would definitely recommend it, because although most of the time what you're asked to calculate you could probably do with mental maths, having a calculator means that you can check yourself and just be completely accurate. It's really important that you show all your working out though, because there are marks available for working out on paper B. So you might have a question that asks you to calculate magnification, for example, and it might be worth 4 marks. So one of those marks will be for your final answer, but the other 3 marks could be for steps that you show in your working out. So look at how many marks there are, make sure you've got as many steps of working out as there are marks available, including your final answer. Be really careful about units of measure. So sometimes you might have to convert 1 or more units. Make sure you've clocked that at the beginning. And I always recommend that you convert at the beginning of your calculation, so that you're then just working in 1 unit of measure thereafter. Write down your conversion though, because you could get a mark for that. And if you're using an equation, so for example the equation for magnification, if you rearrange that equation to answer your question, write down how you've rearranged it, because again you could get a mark for that. So really important that you write down every step that you put into your calculator, write down on your paper B. Okay, so discuss questions. I will hand over to Laura for this one.
Okay, guys, so for the discuss questions, we want to be focusing on the quality of your discussion now. I know I sound like I'm stating the obvious, but what we want to be asking ourselves is our answer fully developed and detailed? Okay, so have we closed that loop? Have we linked it back to the context if there is some available? Is it informed and supported by rationale? If there's an opportunity to provide judgment, have you created balanced judgments with those? And have you shown a chain of reasoning for your discussion? So have you shown why? How have you shown how you come to that decision, or what is your rationale behind it? And again, thinking about showing as many of those key terminology as possible.
Okay, so this is a good time to bring in Billy Joe's question, which is, do we have recommended structure for questions, especially the 6 and I think you mean 12 markers? Charlotte, I'm going to hand back to you, because you've already mentioned what, so what, now what. Would you like to explain that again, and how we would use it in like a 6-mark discuss answer?
Yeah. I would say that there isn't a specific structure that you would use definitely for your longer answer questions, because if you look at the mark scheme, you're marked on your quality of answer overall. So thinking about moving away from that level 2 way of writing, so your GCSE level way of writing, we're now writing a little bit more coherently. We're writing to a higher standard. And so you're not assessed on how many points you've made particularly. You are assessed on the quality of your answer. So in terms of structure, we tend to, like I've said, we suggest our what, so what, and now what. So if you are making a point, we're keeping on going with that point. And then sometimes it's quite easy to do that and then have that magic word of however, and have a counter argument as well. So when I teach my students, discuss questions, evaluate questions, anything that's for a 6 or a 12 mark, I say in your exam, imagine that we're in a classroom and Charlotte has split the classroom in half. One side is talking about the benefits and the other side is talking about the limitations. And what you are going to do is you are going to discuss, debate with each other, and then that's what needs to be happening on your page. So you need to be having that discussion on your page about benefits, limitations, but as you're going, thinking about making sure you've fully expanded the points that you've made. So you've said what the impact is, how that might impact an individual, and then what are the next steps? What's that overall? Because if it's a treatment, you might then talk about what's the overall benefit, how it's going to limit somebody, what treatment might be available next time. And all of these skills then go into your overall quality of your answer. So your ability to have a discussion, it might be a bit of an argument within your page. Hope that helps.
Okay, so linked to that, Doreen has asked a question. in your discuss questions, are you talking about the bad and the good of the thing you have been asked to discuss? I would say, Doreen, it really depends on the specifics of the question. But often, yes, because as Charlotte's just said, a discussion, you can think of it like a conversation where you are conversing about a topic with someone and you're diving into it and you're considering, the key points about it. What is the most important thing about it? What is relevant? It might be about impact. It's often about impact, as Charlotte said, either on you as a professional, on the service you work for, or the service users that are using that service. So it can definitely be about advantages, disadvantages, benefits, limitations. Anything you want to add, Charlotte, to that question?
Just going to say hi, Doreen, because I think Doreen is one of my students.
Amazing.
Yeah, adding on to that, Doreen, definitely. So when we're talking about the language that's being used as well, so somebody had asked about how we can incorporate different a higher standard of language. So instead of saying bad and good, thinking about an advantage of this could be a disadvantage or a benefit or a limitation or a strength or a weakness. So you would be doing that, but it depends on what the topic of the question is. So if it's about a health condition and referring to treatments, then that's going to be advantages and disadvantages. Where if it might be something about multidisciplinary working, it might be that you talk about the benefits of multidisciplinary working and then the limitations of it as well. So it's quite similar, but then tailor it to the question that you're being asked.
Brilliant. Okay. So let's have a look then at our slide on these evaluate and assess questions, which we all love to hate. Laura, tell us about these questions.
Okay, guys. So for your evaluate or assess questions, if you're asked to evaluate or assess a statement, plan, or data, you must pull that statement, plan, or data apart. Okay. So what we mean by that is think about what is accurate, why is it accurate, and what is your evidence. And then, as opposed to that, think about what is inaccurate then, and why is it inaccurate, and what is your evidence to support that. So don't forget to reach a conclusion that answers the question. So for those evaluate questions in particular, we need to be including a conclusion at the end. It does show that high level of writing and that quality that Charlotte was talking about before, that you are marked on for these questions.
Yep, so I just want to say, I said earlier about data on paper B. So often a question on paper B might be, there'll be some data that you have to look at. It might be a graph, it might be a table. And then there's someone that has made a statement or reached a judgment about that data. It could be a professional, it could be a student. And then you're asked to evaluate their statement or assess their statement. So what you really need to do is look at what does the data actually say? And then how has it been interpreted in that statement? Is it correct or not? And then your evidence you take from that data that you're provided with, okay? And then if you think it's inaccurate, you say it's inaccurate because the data says X, Y, and Z. And, you'll often be asked to do something like evaluate the usefulness of the statement or evaluate the judgments that have been reached or the accuracy. So make sure at the end you have actually answered that question, because what we do a lot, I think, with these 12-mark questions, because they're quite detailed and in depth and they're quite long, we write loads of stuff down and then we forget that actually you've got to bring it all together at the end and actually say what your conclusion is. So is the statement correct? Have they evaluated the data accurately or not? Charlotte, anything you want to add on this?
With this type of question, particularly for paper B, what I've found is say what you see. I mean, sometimes that students overthink what they've got. So the answers are there in front of you. So if you see that something isn't correct, then that's because it's probably meant not to be correct. So go ahead with what you can see, and try. We obviously want you to think about it. We obviously want you to really have good thought processes when you're marking your work, when you're writing your answers, but try not to overthink. And sometimes it is as easy as, oh, that's incorrect. I need to then evaluate this and say what I could do or say what it should be done in the next steps.
Brilliant. Okay, we've got a couple of really nice questions. Let me just see. I think that's our last slide on question types. So let's have a look at these questions then. So Milo says, what do you feel is the most important areas to cover for the Core A exam with a week to go? That's like the $1 million question. I'll go to you, Laura, first for your thoughts.
Oh, that's a tough one. I'd try and think about what I refer to as being the golden threads throughout the papers. In particular with paper A, I think there's a lot to do with safeguarding. Now, straight away, when I say the word safeguarding, we probably think about protecting people from abuse and harm and neglect, but it's much wider than that, guys. Think about how we keep people safe, the service users, the staff, what legislation links into that, the policies. It's much more than just protecting them from the harm that you think of in terms of abuse and neglect. It's about keeping information safe, keeping them safe at work, how they can access services and safe from discrimination, etc. So I'd try and focus on those topics that are more of an umbrella term and think about those key concept maps that we talked about earlier in the slides. I'd create some of them with some of those topics. What do you think, Charlotte?
So we tend to have in our longer answer questions, in our 6 mark questions and 9, 12-mark questions, there seems to be sort of hot topics. So generally aspects such as multidisciplinary working, the use of AI or the use of technology within the sector tends to be either a 6, 9 to 12-mark question. Don't quote me on this if they don't come up, but this is sort of some key themes, like Laura said, some golden threads. What have I said? Sorry, multidisciplinary working, the use of technology / AI, and that's quite big in the nation at the moment as well. So we've also got aspects of infection control and our, I always say this word wrong, but I'm going to give it a go, our antimicrobial,
Microbial.
that's the one. Resistance. So there's usually some questions around that sort of aspect as well. And another aspect is public health approaches and public health teams and how we've got health education campaigns and things like that. So those for me are probably the hot topics, as well as safeguarding, obviously, and data protection. I could probably just talk through the whole spec.
Yeah, I would say linked to that, I would think that you can often, almost always, link your responses to things like empowerment, rights, choices. You know, person-centered care is massive. I know it has its own section, but it can be applied to your other sections as well. So Jem has asked a nice question. Is there a correct way to refer to a service user? Is it better to call them a patient or a service user? So I would say, Jem, if the service user is given a name in the scenario, use their name. Otherwise, I think service user is probably preferred to patient, because patient does have some connotations that maybe don't suit all service users. I don't know, Charlotte, do you have any other?
I would use your best judgment in terms of what the scenario is. So if it was a hospital setting, then generally they would be classed as patients. If it was a residential home, they would be classed as residents. But again, like Liz said, if you're given a name, which as far as I know, most of the time you are given a name. So I would refer to the patient as their name. But if in doubt, service user would be fine. I will also, because a lot of my students, I was telling them off this week, because they have a habit, and I've said it just then, they have a habit of saying they will do this to help them. So who are you talking about? I have no idea who you're talking about. So health professionals would complete this task to assist patients, or just putting it a little bit more professionally speaking, they will do this to help them is not telling the examiner that you know what you're talking about or who you're talking about.
Yeah, that's a really great example. I like that. Okay, so a question from Laura. When writing about legislation, if we put the wrong year or no year, will it impact our answer at all? Laura, what do you
Laura.
think?
Now,
Laura's examined on this before, so
your examiner is human, so we can't speak for all examiners, sadly. It depends how harsh they are. Yes, it will impact because you've been taught the correct legislation and the year. However, that does not mean don't include it in your answer if you can't remember the year. Have your best guess. Even if you put the wrong year, put a year because you're showing that it's a piece of legislation. Sometimes if you put in the name of a legislation with no year at the end, it might not be that apparent that you're actually talking about legislation, if that makes sense. Do you get me?
Yeah.
we'll get you.
I would say that the most important thing is to get the correct title of the legislation and to include whether it's, a regulation or an act. So Health and Social Care Act, Mental Capacity Act. I'm trying to think of a regulation.
And your capitals. Remember your
RIDOR
spag.
is a regulation. Yes, and also capitalising the first letter of each word in the title does clearly show to the examiner you are talking about something formal, not it's not just words on a page. So yeah, I think try, Laura, to add the date if you can. If not, be very accurate with your title of the legislation. I think that's all our questions. So let me just move that one out of the way. So final thoughts, everyone. So get plenty of sleep over the next week. So yes, we're expecting you to be revising, but not at the sake of not getting any sleep, because you need your rest, you need your brain to be working well. Linked to that, I would say if you can, eat lots of good foods for your brain, so eggs and oily fish, leafy greens, dark chocolate, nuts and berries, and stay hydrated because your brain needs fuel and hydration to work properly. Do have a positive mindset. You have all been taught amazing things about healthcare. You've all got amazing lecturers and teachers. You've taken in huge amounts of information, and you will be able to gain some really great marks in the exam. And then the final thing I want to say is we're going to do individual paper warm-ups. So 6 p.m. next Wednesday, which is the night before your Core A exam, we'll be doing a Paper A exam warm-up. And it will be with myself, Laura and Charlotte again, and we're going to be doing like fun, low stakes revision and quizzing, nothing too scary. So join us for that. And then I have moved the Paper B one because I can't do the following week. So Paper B we're going to do on Thursday the 12th, so next Thursday. So after your Paper A exam, you can all tell me how it went. And then we'll do the same thing for Paper B on that Thursday night, and then you'll have just under a week before your Paper B exam. So thank you so much, guys. Thank you to Laura and Charlotte as well. Happy revising over the next week, and we'll see you again very soon.
See you next week, hopefully.
Thank
Bye.
you. Bye.